Bitte sehr, Herr Professor.
Dzień dobry. Wonderful good morning. Guten Morgen. I'm very happy to be here this morning in Warsaw, and it is for me the very first time that I'm in your country, and I'm happy that there is on a Sunday morning such a big interest on a very strange topic which we are going to discuss today. Of course it will be more difficult because laser is not only an instrument, but it's a technology and is combined with a treatment concept which is for us as dentists, due to our education, wherever we have been educated, whether in the US, in Japan, in Europe or somewhere else, is not integrated in our normal curriculum of education. So that means we have to study something completely new, even that we are already dentists. On the other hand, there is a big difference between our conventional treatment, which is normally based on mechanical interaction. We feel, we press, we pull, we move, and with lasers we have a biophysical interaction. So the challenge for me today is, of course, to give you an introduction, not only on the functions, but also on the indications. And I hope I will manage in time that you get a real overview and an understanding of what possibilities are given to use a laser in different kind of dental applications. Just to give you a short view, I know Aachen is not very well known, maybe Frankfurt or Berlin or Munich, yes, but Aachen. This is our city hall, and interesting enough, in the year 800, in Aachen, Karl the Great was founding the German nation. Not in Berlin, and not in Munich and somewhere else, but it was in Aachen. And in this old dome, as you see, built from 786 and to 799, this octagon, 20 German kings have been crowned in this cathedral in Aachen. Also, our university is actually a technical university, and is one of the 5 universities of excellence in Germany. And so we are very lucky that also the medical faculty, medical and dental faculty, actually here, that is the place where I'm working, on the edge of Aachen, a little bit outside, where we have also our Aachen Dental Laser Center, where I'm working now since 1990, in this place to investigate and to do research in the field of laser dentistry. But not only in dentistry. I want to make that very sure to you as dentists, to us as dentists. We are working with lasers, but in very many different fields, the use of lasers is today common. And if you think especially about ophthalmology, yeah, the use of lasers in eye surgery, nobody would actually doubt whether this is a good therapy or not, and people would like to do it. Only in dentistry we have a certain kind of distance or maybe some misunderstandings, and I will also come to the point why this was. So, as you can see, we are, as dentists, we are embedded in a huge field of different other disciplines in medicine using lasers. We have done all that. What I'm going to report to you is not something coming out of a pocket, but it is basic research work which we have done at our university, and this was also combined with the clinical application. So what I'm showing you is out of our own, of my own experience treating also patients. Yeah? So this is a combination, and that is why already in the year 1992 we started with postgraduate education in order to help dentists who have bought a laser how to use it, what kind of settings, in which way to integrate a laser into their normal dental treatment activities. One thing is very important to me, and this is what I want to quote to you and what I'm always quoting to all my students. There is a sentence of Copernicus where he mentioned, to know that we know what we know, and to know that we do not know what we do not know, this is true knowledge. Now that is a little bit philosophy, yeah? But very true philosophy. I think it is very important to know what I know, but it is even more important to know what I do not know. Most of the time, especially I want to quote us as researchers and professors at universities, when you are now a professor, then you think in your field you know everything. It's not true. Yeah? So when I started with laser research, my knowledge was zero. Yeah? So I had to be a beginner. And it's always good to know that there are different things I do not know. And even today, when I'm going to special conferences, I will learn a lot of things about lasers, even that I think I'm a specialist in that area, yeah? Since many years. But it's always good to know that there are still things missing, and that is what I want to encourage you. Be open and try to follow that maybe you can increase at least a little bit your knowledge in a different field of laser-supported dentistry. I want to give you a short introduction into the history of laser. Very short, very simple, very easy to understand. When we go in history, one of the most important physical findings was the electromagnetic theory described by Maxwell. Later you will see why this is so important. Without this theory we could not quote where our lasers are. Then of course Einstein with the quantum theory of light was very important. A very, very important theory, 1917, where he got also his Nobel Prize, are the absorption and emission mechanisms by Einstein. And so it goes on with the laser principle, and last but not least, in the year 1960, the first laser effect in the ruby laser was done by Theodore Mengman. Since 1964, there were the first tries, let me say it like this, tries of applications in dentistry. We have 10 different wavelengths in dentistry. So please, this is one of the most important parts that you will understand, or which you should understand. I would be happy that we are not talking about one laser, but wavelengths. There are different wavelengths. So 10 different wavelengths. In dentistry, we have more than 30 different laser systems. Yeah? We can combine it maybe a little bit like with cars. Yeah? We have different cars and we have different companies to manufacture cars. And we have more than 40 years of research with more than 1,500 listed publications. Listed publications means they are in international journals, peer-reviewed journals, so high-quality journals. So that is why later on I will also reflect to evidence-based parts. Yeah? What means laser? We are just talking about laser. And as always in the English language, there is a shortcut and an explanation behind the shortcut. It means light amplification by stimulated emission of radiation. So a very special stimulated light, yeah, is brought to the surface, in our case, of tissue, in industry, on materials and other parts. We have a very high power density on a very small spot, high energy, which is going to influence the surface. We have a monochromatic light, from the Greek word chromos, color. There is only one color or one wavelength. And of course we have a collimation, that means all the light is focused on one point. To make that more clear, on this side here, when you look outside the sunlight, it's a polychromatic light. Many different wavelengths. That is why if we have the thunder weather and we have a rainbow, we see different colors. So that means there are many different wavelengths. And on the other hand, the laser is only monochromatic, one color. That means we have here a low energy density. We can walk through the sunlight, maybe in summertime, and if we have exposed our skin and we are hours in the sun, we are burned. Then it's high intensity, yeah? But with the laser, we have a high intensity, which will change the optical properties, that means the interaction of the skin. So, what I told you, the electromagnetic spectrum is a part where we find a lot of common instruments we are using in our dental office or at home or in some other places. For example, the X-ray machine is a part of the electromagnetic spectrum. Very high frequency, very short wavelength. This is why the light can go through the body and can draw different kind of pictures. On the other hand, we have the visible light. It's a very small part here. I have just enlarged it in a way. Then we have the infrared area. So this is a part where we find a big number of lasers we are using. So we cannot see the light of the laser. We can only see the action of the laser. Only this part can be seen, and this little laser I'm using is a helium neon laser. It's a red laser, yeah? But the other lasers which are used. And then we have microwaves and radio waves. All are a part of the electromagnetic spectrum. So we can understand, due to the electromagnetic spectrum, we can differentiate also the different laser wavelengths. You understand? That is important for me. That we understand that we can differentiate something. We cannot put and say, only here, this is laser. No, it's not true. We have different wavelengths in the visible part and in the invisible part. That means in the part here, between 400 and 700 nanometers, and in the part of the infrared light. Now we are coming, and now I think you will be happy to see a very nice picture. Laser research in dentistry, question mark. You remember, I told you, in the year 1964, first investigation by Stern and his colleague was done. And what was the intention as a dentist? What would you like to ask me today? Can we do what with laser? To clean some periodontal pockets? No. I think you will ask, can we do some cavity preparation? Can we do a drilling? That is always when we as dentists are confronted with other persons. If you go somewhere to holidays on a party or wherever, and you say, I'm a dentist, they will always say, oh, drilling, you know? So that was also the intention for the first researchers, to find out, is it possible to use a laser to supply maybe at that time the low-speed handpiece. It was the challenging time in the 60s, the birth time of the high-speed drill, now lasers. Now there was a competition. What happened? What can you see here? A nice cavity, very precise, very clean. Oh, not at all. Burning, melting, carbonization. And as a good researcher, you're writing a conclusion. And the conclusion was, lasers are not suitable for dentistry because of high thermal effects. And career of laser was dead. Yeah? Because now all the professors, all the researchers said, okay, we cannot touch a laser. But what was the mistake? And why are we sitting here today? And why do we have to discuss this problem? Nobody would come to a lecture if we would talk about a high-speed drill. Is it possible or not? Everybody would say, silly, we can use it. But with the laser, we are unsure. Because a wrong wavelength on a wrong wavelength on a specific tissue was used. Later we will come on it. So that was the first problem. The research was done on trial and error, not on knowledge. Then treatment concepts without evidence. No specific research. Somebody tried something, oh, it's working, okay, we can do it. Another one was trying to do something else, maybe it's not possible. So this is not a way to implement